My name is Sam DeLapp, and I'm the Program Coordinator at North Carolina Campus Engagement. And it's my pleasure to welcome those of you here today to the Civically Engaged Student Webinar Series, which we're all joined for here today. So the Civically Engaged Student Webinar Series features student leaders from the North Carolina Campus Engagement's network of 40 different colleges and universities all throughout the state. So the students who are here and the students who have been leading these presentations within the series are both highly experienced and highly involved, and they are actively involved to better their community through different community and civic engagement efforts on their campuses. So this series highlights the different programs, projects, initiatives, skill building activities, and multitude of other things that these students have found to be both effective and successful. And they're sharing some of that wisdom with you today to hopefully inform and inspire your own civic engagement efforts. So this series did take place each Wednesday this month. So I invite you to go back and watch the recordings of the other sessions as well, so you can get some more information. So today is a dual session presentation. So we'll have two presentations followed by a Q&A for both presentations at the end of the hour. So without further ado, we're excited to get started by welcoming today's first speakers, Aynsley, Szczesniak, and Jailah Lytch. Aynsley is a sophomore at the University of North Carolina at Chapel Hill, studying biology, mathematics, and entrepreneurship on the pre-medical track. As the founder and CEO of Out Sisterhood, she is passionate about bringing youth voices into critical conversations about women's career advancement. She's also the youngest member of the advisory board of the Carolina Women's Center at UNC-Chapel Hill and the North Carolina State Lead of Million Women Mentors, and has spoken at conferences, webinars, and panels about the power of social entrepreneurship to build skills and strength for success in STEM. Jailah is a junior at the University of North Carolina at Chapel Hill as well, majoring in biology with a minor in health and society. She is a dedicated community health volunteer with a strong passion for women's health and societal well-being. Her interdisciplinary interests lie at the intersection of medicine and sociology, focusing on how people interact and how social structures influence health outcomes. As a young Black woman, she finds empowerment in connecting with others who share her experiences and working together to create meaningful change. Through her volunteer work and academic pursuits, she strives to advocate for equitable healthcare and foster a more inclusive society. So Aynsley and Jailah, take it away.
Awesome so much. Hey everybody, my name is Aynsley, and as Sam said, I'm a sophomore from UNC-Chapel Hill. Super excited to be here today to talk about something that I care very deeply about. And yeah, so I'll go ahead and kick us off. Jailah's going to chime in here every now and then as well, but we're really excited to share with you a little bit about the work that Out Sisterhood does, particularly in relation to this theme of civic engagement, and in our case, youth and young women civic engagement, and how our work parallels to the power and connects with the impact that civic engagement can have on communities. So I want to go to the next slide. So Out Sisterhood is a global nonprofit empowering young professional women in STEM to be change agents. As the founder and CEO, I built this company about a year and a half ago out of frustration of realizing that there is a major gap that exists between young women who care very deeply about the issues that permeate STEM and young women who were planning to enter a STEM career and saw those issues firsthand, saw how gender bias is still so pervasive, saw how so many women are not reaching leadership roles in these spaces and wanting to do something about that, but not having a space or a foundation or opportunities to really be engaged. As a freshman at UNC, coming in and being surrounded by young women who felt the same way I felt, I realized that it was more than just a me issue. It was something that a lot of young women were feeling. And then on the other side, seeing how there's so many organizations, seeing how there's so many organizations that are doing incredible work to empower women, but are failing to include the very important voice of young people in these conversations. Because yes, it's important to be able to draw on research and draw on adult perspectives when we're thinking about how can we advance equity and inclusivity in fields like STEM, but having the perspective of the next generation of STEM leaders is equally, and if not more, essential, because we are the next generation of leaders. It's important to make sure the voices of young women are included in these conversations about how can we make STEM more equitable for women. So that's where this organization came about. And the main the pinnacle, the flagship program that we run, which you'll see on the next slide here, is called Generation YES. Wait for this slide. It's an 8-week virtual internship program for undergraduate women, where over the course of these 8 weeks, they will develop social impact projects, solving some barrier to women's advancement. And so we work with a partner company. For example, we've worked with Gorilla Mexico, which is an affiliate of the United Nations Foundation. We've worked with Hesperian Health Guides, which is a global medical education organization. And we've also worked with some more local organizations that have ties to civic engagement, which we'll get into in a second. And they're given this issue from the company partner, either some question to be researched or some problem that the company is facing and wants to see solved. And over the course of the 8 weeks, they'll work in a team, they'll have an advisor, they follow the design thinking process through a project curriculum that we built. And at the same time, they're also learning these pillars of emotionally intelligent leadership that research shows translate very well to leadership in STEM and self-advocacy and all of these skills that are so necessary for women to be able to ascend to leadership in these STEM fields. And so we, over time, we've built this program in response to feedback that our interns have provided us, while maintaining those pillars and really learning more how we can fill this niche that we're starting to realize exists, where young women who care so deeply about these issues want to be able to have tangible impact. And yeah, so what do we want to talk about now is a case study, because Jailah actually was an intern. And so in fall 2024, we worked with this organization called the Science Policy Action Network, where the problem statement we were given from SPAN was all about policies to support women in the workplace. So obviously there are many different ways that a workplace can go about promoting career success in women, but what we were looking at, and particularly SPAN being an organization that works a lot with state governments here in North Carolina, was curious about what are some policies that perhaps we could advocate for on the legislative level to promote career success of women in the workplace. And so Jailah actually was on the team that did this project, and so is going to give sort of a firsthand account of exactly how the team went about doing that and how it obviously relates to civic engagement. So take it away, Jailah.
Hi guys, nice to meet everyone. Yes, I was so fortunate to be a part of this project. It taught me a lot. I was just a junior. It was my first time doing anything in research, and so this is my first research opportunity. I did it last semester, and we really just wanted to focus on making the issue real. That was the very first thing that me and my group decided, like, we needed to make sure that like this communicated well to male-dominated fields wherever this project will go. We wanted to make sure that we're making the issue serious. And so one of the first things that we did, we wanted to make sure that our project results reflected factual evidence. And so at first, you'll see in the upper hand right corner, we kind of have a layout of the Gender Equality Act. And so we included laws, we included statistics, real numbers in the United States and outside of the US that just kind of showed the discrepancy between women and the workplace. And so we wanted to present it in a simple way. We wanted to make sure, like I said, our issue was real to our audience first and foremost. And then after that, we focused on a more holistic approach in my group. And so I was a part of getting interviews. I was able to interview an amazing woman actually she works at UNC, one of the organizations with UNC. And I just kind of asked her questions about like, what are some policies that you feel like are not working? What are some areas that you need help in? What are some areas that you think needs to change? Are you happy in your workplace? Are you feeling supported? If you're supported, what support are you getting that we can, kind of spread out into every workplace? And so it was an amazing opportunity to be able to speak to someone who's actually in that environment. We only wanted to present solutions from the population we are seeking to help. And so that was a really important thing for our group, is we don't want to come from a place of, naivety or just be biased and just kind of say, oh, this is an issue and these are solutions that we think need to be fixed. No, we wanted to make sure that we reached out to real workplace environments where real women were working their 9 to 5 or whatever they were doing, and kind of hear from them, what do we need to change, what needs help, and what needs to be better. And so we wanted to make sure that our research ultimately presented quantitative and qualitative solutions and data. And that was the way that we were able to really connect with our experts. And so, like Aynsley mentioned, SPAN Inc. is an amazing corporation. Dr. Watkins, you'll hear a little bit later about him. He is amazing. We were able to present our solutions to him. And he was just a person where we said, you know what, like, we're young students, we're in college, and sometimes it's hard to make change when you're sitting here on campus, but you're in power and you have a corporation where you consult with firms and you help companies develop and implement these solutions. And so we really made sure that after we presented this data to him, we came to him asking him for help. How should we implement this? And he was able to connect us with some really amazing people to make sure that our research spread out through these different workplaces in the United States. And so that was amazing. So yes, we just focused on data, qualitative information, stating the obvious, and then last, just educating one another on the issues at hand facing women in STEM. And so you'll see on the slide here, these are just some things that our interns engage in. So like I mentioned, we were able to connect with some amazing policy leaders in North Carolina. Some of our interns, like me, actually worked with women that were affected by the policies. Some of the ladies were able to work alongside professors on gender and corporate life. And then lastly, guest expert on workplace success. So like Dr. Watkins in my group, we were able to connect with him, and that was a really amazing person to engage with.
So one thing that always drives me with the work that we do is no worries. So one thing that has always driven me with this work that we do is, yes, we can plan out these frameworks of, oh, you know, youth are really going to like this, or, oh, this will be a really cool way to connect young people with issues. But if we don't have tangible measures for showing, is this actually effective in boosting civic engagement, in building leadership in young people, in actually addressing tangible issues in a way that makes everybody on all sides feel like some progress is actually being made, then what's the point? And so what we want to do now is kind of showcase a little bit of how we track success. You want to go to the next slide? I, as the CEO, I kind of look at it very strategically with the work that we do. And so we have three metrics of success. The first, obviously, being quantitative. So we have surveys that we conduct throughout the weeks of the program, and we look and see how the changes in the intern responses progress through over the 8 weeks, preferably, hopefully, in a positive direction, which I'll show you in a second. The second is we also have that qualitative feedback, which we will show as well, with testimonials of, do you actually feel like you are connecting with people who are, you know, going to be helpful to have in your network moving forward? Do you actually feel like you're making a real impact? Do you feel like your voice is being heard? Because that matters, I feel like, even more than the numbers, because you can build a program, you can have people check off a box and say, yeah, it was great. But if they don't feel empowered, if they don't feel like they've actually connected with people who are going to help their voices translate into tangible change, then what is the point? And then the third is just a little anecdote for me, because on the programmatic side, having a program that actually runs smoothly and doesn't have problems is always really nice. So I figured I'd throw that in there as a humanizing factor. But if you see here, so some of the numbers that we have here, and you can see just visually, we're working still on like sort of some statistical analyses, so I don't have any particular statistics of like, oh, this is significant, etc. But you can just see visually here, there's a clear positive trend in the and how interns respond to, in this case, statements like, I actively seek creative solutions, I'm comfortable experimenting with new approaches. And those are really powerful mindsets for young people to have. And especially to see young people starting out kind of in the middle and then gravitating toward being more confident in saying those things, because those are the kinds of mindsets we want to have in young people as we are entering the workforce, entering the next chapter of our lives, because those are the mindsets that build leaders. And then in terms of sort of more qualitative testimonials, Jailah, go ahead.
Yes, so first off, I want to just speak from my own experience. Out Sisterhood has been amazing, and I can't stress that enough. I've been going all over campus at different events telling people, no, you should do this internship program. It was amazing, and I really, really learned so much. And I think the biggest thing, like Aynsley mentioned, is like feeling like you really made a difference. I remember after our group presented our information to Dr. Watkins, as this quote is saying, like how proud of us he was. He truly was speechless, and he wasn't just kind of like a passive, oh, great job on your project. No, he was like, guys, this is something like I would have expected to see this like at a consulting firm, like meeting with people in policy. And he was just very excited for us and with us about the issue. And I think that was the best feeling, is feeling heard. And like Aynsley said, making sure that like I feel like I truly did something and I truly contributed to making change. And so I love that about Speak Out Sisterhood, and I love that about the program. And so here I'll just kind of read off some quotes that, some testimonials of people that have been through the program as well. One of our interns said, Dr. Watkins was super happy and proud of our presentation. He also seemed really inspired to help us get an audience to pitch our ideas to. And again, that was just an amazing moment, just hearing somebody who's super up there just be like, you guys did amazing. So that felt great. Another intern mentioned, I would love to continue partnering with Hesperian Health Guides to see how I can get involved and possibly get a position with them to increase my experience with this topic. I have learned so much through this experience and want to continue to make an impact in all the ways that I can. And so another thing with us is networking is key, and I love that about this program as well. Being a part of Speak Out Sisterhood, I learned so much about advocating for myself and the things I'm interested in. This program gave me a great confidence like this intern here, as well as that it doesn't have to stop at a research internship. It doesn't have to stop after the 8 weeks. It should grow, just like this intern mentioned. It should allow us and push us to take advantage of the opportunities that we've made in the networking and the just amazing people that we meet. So that is an amazing thing about our program. And again, Dr. Watkins said he would call up some people to discuss our ideas. I could see us directly communicating our policy recommendations with actual decision makers and potentially seeing them get implemented. And the last one here, I believe I have strengthened my skills in project management and communication. Having this opportunity to lead an initiative, which I was fully in charge of, has allowed me to develop a strong foundation in managing projects with a clear vision and measurable outcomes. In addition, this has deepened my understanding of systemic inequities, shaping my ability to advocate effectively. And so again, some amazing skills that we gain and that we learn in that Speak Out Sisterhood and make sure that the women who in it develop is project management, leadership, communication, and like they mentioned, understanding the systemic inequities. We want to make sure, like, yes, we understand that there is a discrepancy with women in STEM, but making that real to us and taking that and doing something with it, not just leaving it there, truly understanding that it is systemic and that it is something that we can contribute to and make change with. And I just believe all of these are skills that we do a phenomenal job with in terms of equipping young women in STEM. And this is what really pushes them to take action and get engaged in that, civic engagement that we are here for. So I love that about this program.
So again, as I said, I'm a STEM person. And so when I think about the work that I do, I always think about, is there a connection between this part of the work that we are doing and our eventual outcome? Because our program exists on a basic level, yes, to connect young women with these organizations, to build leadership skills of women, but the broader goal is we want to equip young women with the skills and strengths for success in STEM. Once they enter that STEM career, they don't fall victims to the leaky pipeline. That is a phrase that is tossed around a lot in these arenas of women who enter a STEM career and then choose to leave or fall out or become burnt out or disillusioned because they are not equipped with the ability to navigate the challenges that are inherent in being a woman in STEM. And so what I want to sort of highlight here in the next few slides is there's some it's fun being a researcher because you sort of are able to build links between disparate research articles and disparate findings to come to a broader consensus of why the specific perspective you're adding to these conversations does matter. And so in our case, we look at research about leadership skills that we're building. We look at research about women in STEM and particularly women's leadership in STEM. And these are two articles that I just want to highlight on the next two slides, starting with the first one here, that really showcase why our work matters. So this first one is a study done in 2015 on undergraduate student leaders, and particularly looking at self-esteem. And so one of the things that we try to build with our program, right, is that self-efficacy, that self-esteem, that ability to advocate for yourself and feel confident in a room. And a study like this showcases that when you have that high self-esteem, you don't just treat leadership based on the position that you have. You move beyond that, and you don't question whether you are a leader, but rather you fall into those behaviors of being a leader without feeling constrained by the position that you're in. And so that's a really powerful finding, given the fact that part of the challenge in STEM is women having to navigate being in a lower position, working to advance to those higher leadership positions, and along the way equipping others around them to have the confidence to do the same. And then a second research study that I really like, and this one is really great because it connects a lot of the different pieces of what we do. And so what this study exemplifies is how, as you can see in this quote here, students who perceive an environment that's focused on fixed ability, and particularly in one in which they perceive greater sexism, tend to have a negative relationship with their perception of self-efficacy and their sense of belongingness, which then in turn leads them to consider dropping out. And that is the key problem that we are hoping to address with our program, which is if we can instead reverse that, if we can build self-efficacy and build that sense of belongingness, build that STEM identity in young women, so that they already have it going into a STEM career, then hopefully we'll be able to mitigate this outcome and be able to avoid women choosing to drop out of their STEM career because they don't feel that sense of belongingness or job environment fit. And so just wanted to highlight these studies in particular to kind of lead into our conclusion here, which is why this really connects to, the topic that we're here to talk about today, which is civic engagement. I know civic engagement tends to sort of have a correlation, at least in my head, of like working with politics, working in a government, etc. And what I want to definitely stress about our organization is, yes, our programs do focus on issues that are more focused broadly on the career success of women in STEM, not specifically on like legislation or federal STEM policies, but by engaging with these stakeholders, by conducting research on policy, not just specifically for the purpose of creating more policy, but also just maybe in a different project, because we have projects that work on everything from menstrual equity to safe pregnancy education to financial literacy, which have a connection obviously to federal policies and state policies and local policies that exist. And by engaging with these stakeholders, by engaging with policy, our interns are going to build this, are going to gain this valuable exposure to how powerful civic engagement is, seeing the way that policy does intermix with a lot of other aspects of being a woman in STEM, and then also be able to produce tangible solutions to these wider ranging community issues while also building invaluable skills. So it's a beautiful example of how all of these different pieces really do interconnect, and expanding the definition of civic engagement as not just engaging specifically in policy, specifically in the government, but perhaps engaging in work that aligns with and interacts with policy and government as well. So that's all that we have to share. Thank you so much for your time today. If you're interested in getting involved with the work that we do, we can definitely chat more after this presentation, but we are always looking for advisors, and we always love to do outreach for our programs or about the work that we do. So please feel free to reach out. And then we can probably share our contact info slide just real quick so you can take a screenshot. But we can also put this up at the end as well. But thank you so much for listening to us. Really, really great to be here, and hope to connect with y'all soon.
Wonderful. Thank you so much, Aynsley. Thank you, Jailah. Thank you for sharing your insights about this program and how it's led to success and positive outcomes, not only for the research area, but also for the empowerment of the interns that you work with as well. It's incredible. So we will open the floor for questions at the end. So audience, please make sure that you write down your questions for Aynsley and Jailah and remember them for later. So now I am pleased to transition to our next set of presenters to welcome Christopher Dietrich and Reagan Smith. Christopher is a junior at Wake Forest University, majoring in health and exercise science. He's a dedicated student leader and Public Health AmeriCorps member with over 900 hours of service supporting public health initiatives at the Winston-Salem Community Care Center. Through his work, he helps address critical healthcare disparities while contributing to the training of future public health leaders. Beyond AmeriCorps, he volunteers at the Atrium Health Wake Forest Baptist Comprehensive Cancer Center, assisting patients with essential non-medical resources such as food, transportation, and financial aid. Recognized for his commitment to community engagement, he actively inspires fellow students to serve and uphold Wake Forest's Pro Humanitate motto. Reagan is a junior at Wake Forest University, where she's pursuing a double major in biochemistry and Spanish for healthcare, with the goal of being a surgical oncologist. She has also served over 900 hours with Public Health AmeriCorps. She's stationed at Cancer Services, Inc., a local nonprofit that provides resources to cancer patients and survivors. Reagan also tutors children in her community, helping elementary students gain valuable skills and confidence in school. Her volunteer work and experiences thus far have given her a passion to advocate for those in need of support, whether that's in the hospital or the classroom, to give everyone the best outcomes in life. Reagan and Christopher, the floor is yours.
Yeah, thanks, Sam, for the warm introduction. Yeah, like Sam said, my name is Christopher Dietrich, and I'm presenting with my good friend Reagan Smith. And today, guys, we'll be telling you about forming the next generation of public health leaders. Now, I always like to start off with the question why? Like, why is this significant? Why is this important? So, why is public health important? People will always tell me, oh, I already go to the doctor and, get my medicines. Well, public health really is way more than just visiting the doctor's office, right? Public health or contemporary public health issues that we sort of know of are like things like diabetes, obesity, substance abuse, infectious diseases, like we all know, COVID-19, malaria, HIV/AIDS. But really, that's just the tip of the iceberg. There's also, a lot of public health issues in the mental health field, food insecurities, living in a food desert, if you don't have a healthy food option in your area or in your zip code and only have fast food, that really determines how your health, ends up. But it also includes other things such as environmental pollution, climate change, and even something like wearing a seatbelt. So really, public health is everywhere, and it's a root cause of why people end up landing in the doctor's office. For example, pollution, can cause cancer, asthma. And so in this way, public health aims to sort of work preventatively against mitigating issues. And that's why public health is very important and overlooked a lot of times. So public health can kind of be conceptualized or worked with using the social determinants of health. These are sort of evaluating risk factors that kind of hint at or indicate, a person's health outcome. And so I'd like to use the analogy of an iceberg. So, the services that you get in the doctor's office is, as you can see in this infographic, is only 20% of the health outcome. 80% is, factors we don't really, that don't come to mind at first glance. Things such as more substantial factors like where did you grow up? Where did you work? Do you have a house? Do you not have a house? Where is your house? How old are you? How much money do you make? For example, if I grow up in a neighborhood that doesn't have playgrounds, doesn't have a rec center or something like that, or don't have the transportation means to get there, that might, lend me to sitting at home, watching TV, playing video games, and then consuming snacks, which really has a, detrimental impact long-term on our health. Fortunately, a lot of these factors are factors we just cannot control. Around 50% of these health outcome factors, such as where I live, where I grew up, are things we just can't control. And this number can rise up to 70% too, looking at socioeconomic status and stuff. And so the issue here is that not everyone has the same health outcomes, unfortunately. A lot of social injustices, inequities sort of create a discrepancy within our society of health outcomes. And a lot of that has to do with policies, political engagement, and these are long-term, large-scale, and deep systematic issues we have to work towards. But the issues are here now, right? They don't wait for us. And so we don't want to waste time. And so we need people here and now. We need the future leaders to act now. We need people to engage, and that's where students like Reagan and I sort of took the initiative to start working.
And so with that background in mind,
Today, our presentation is going to be focusing on what is Public Health AmeriCorps, why is student engagement crucial, and how can you implement a similar program in your school or community. So first off, AmeriCorps' mission is to support the recruitment, training, and development of the next generation of public health leaders with a statement of addressing the public health needs of our nation by improving health outcomes for American communities. So public health specifically is a branch from AmeriCorps, and they have a partnership with the CDC, or the Center for Disease Control. This is an organization that has huge backing and support from the community. Zooming in a bit to North Carolina, our home, we can see that there's 103.5 million AmeriCorps scholarships since the 90s, 3,700 American seniors and AmeriCorps members, 31.5 million AmeriCorps and local funding dollars, and over 700 local service sites. Now, what do those service sites look like on a map? We can see that there's various sites focusing on healthcare, parks and recreation, education, art, and law, and this is all the broader scope of what AmeriCorps does. Public Health AmeriCorps focuses specifically on those plus sign sites, those healthcare sites. But as we know, all these other services that we see on the map can indirectly contribute to public health and wellness through those social determinants of health. Zooming in just a little bit more to Winston-Salem, which is home for Chris and I. These are some of the service sites that Wake Forest Public Health AmeriCorps program works with directly. We can see which services and what public health challenges they address. And so I'm not going to read through all of this, but the basic focus across the board is that these organizations tackle the social determinants of health. And we can see how these organizations support needs associated with health that may not come right to mind, like access to care, cost of hospital bills, social support, mental health, and even something like having access to clothing and home items. So now, as it was said, Chris and I both have direct experience with Public Health AmeriCorps. I got to serve a year with Cancer Services, and this is an organization that covers any non-hospital need you could think of for cancer patients and survivors. They have community engagement events, educational events, speaker series, financial aid for housing, bills, medication, medical and mobility aid supplies, and also provide emotional support through support groups and even things such as art therapy. And in working at this organization, I was just immediately welcomed into such a kind family of people who are really dedicated to helping cancer patients and survivors receive the care they need.
Yeah, so as Reagan said, she was stationed at the Cancer Services site in Winston-Salem. I was fortunate enough to be placed or paired with the Community Care Center as part of my AmeriCorps service term. A little bit about the Community Care Center. The Community Care Center is a free medical healthcare clinic, which provides medical services to uninsured patients, which are below 250% of the federal poverty threshold. We have 15 specialties on site, from pediatrics to cardiology, and then just general family practice. But we also have mental health resources and counselors that will consult patients, if they need. We also have a food bank on site, where we typically partner with other community partners such as Second Harvest and many more to get patients, food that they need. On top of that, we also have a dietary coach who sort of walks patients through, specific foods that they can eat, especially patients who have diabetes and need to pay attention to what they consume. Now, the coolest thing about the Community Care Center, in my opinion, is that it's exclusively volunteer run. So we have 327 volunteers volunteering the last year, which is awesome. So I always say the Community Care Center is at the heart of the community. So how does Public Health AmeriCorps support organizations? So the quote you can see on the bottom here, that's from the Community Care Center's website. The Community Care Center benefits patients and gives them the medical care that they need, letting them stay at work, letting them stay at school and out of the ER. And that's really where, the light kind of shines there. The CDC really has a larger impact in that way, because we don't only provide healthcare, but we give them time. And thinking back to what I said earlier about social determinants of health, this really has a big impact as patients now have more time to, for example, exercise, or have more time to provide for their families and kids, which really has a ripple-on effect or domino effect in that sense. Now, the cool thing about our site is too that it's a free healthcare clinic, and last year we provided around $14 million of medical services, and saw a 90% improvement in patient health. I think the more important stat here, though, is also it saves patients $11 million, and more importantly, time, going through all the bureaucracy and long waiting lines in the ER. That stuff takes a lot of time, and also, freeing up crowded ERs. So in that way, we really are interconnected with helping other issues in the community and alleviating some of that, some of those struggles. Now, an average, so like I said, 327 volunteers served last year in the community care center, and that total up to around 13,000 volunteer hours. It really shows how volunteerism is important. Now, as Sam said, Reagan and I both did 900 hours as part of Public Health AmeriCorps. I did some math here, and that averages to around 20%, somewhere like that, which is really, substantial, because the average volunteer, volunteers around 3 hours per week, plus or minus, whereas a Public Health AmeriCorps volunteer will do anywhere between 10 to 20 hours per week, and then work full time, usually in breaks, like summer break, spring break, etc. And so in this way, you can get more in-depth training and sort of an understanding of the services and the ropes in the community care center, and sort of understand the craft and what really is at need. So identify sort of issues that you can work on as a student worker, such as translation, such as lab assistance that I did, working in the food bank, and there's so much more. And you always find something new that you can do, which is always cool. And in this way, Public Health AmeriCorps really allows the student to make a really meaningful, long-lasting impact. Now, how does Public Health AmeriCorps sort of benefit the student? Well, I went in blind, I'll be honest with you. I did not really know what I was kind of getting myself into. But the first thing that I really realized early on was kind of the idea of responsibility. Responsibility in the lab, for example. So I would work many of my hours in the lab, doing glucose finger sticks, STI tests, COVID tests, pregnancy tests, flu tests, urinalyses, a bunch of other science words that I won't say here right now. But doing all these things, and on top of having a staff shortage in the lab, put more responsibilities on my shoulders. It required me to provide the healthcare with the patient that were there. There were times when I would be alone in the lab, and having to, do the needful, and give the patients the meaningful and important resources and healthcare things that they need. And so in this way, this responsibility that you kind of get thrown into a little bit, it shapes you, the way I like to say. And I've noticed, kind of reflecting on it now, that really translates into leadership. So the idea of, like, you have challenges, you have boundaries, obstacles you got to navigate through, and then that really, allows you to develop these critical thinking skills and really shapes your leadership abilities and capabilities. Next, I also enjoyed serving with a diverse patient population, or for diverse patient population. So is around 77% of our patient population is Hispanic, and many of these patients don't speak English, or very little English. I speak multiple languages, but unfortunately I don't know Spanish, and this kind of forced me out of my comfort zone sometimes. When you're kind of sitting there with a patient and doing a lab test, for example, and not being able to communicate a lot or properly. And so this kind of pushed me to start picking up phrases in Spanish, started a Duolingo on the side, something small like that. But and even though my Spanish really didn't improve that much, it kind of showing the patients that I'm kind of taking a step forward towards them, really gave them comfort and trust. And I think the idea of trust was the most important thing there, because they can now trust the person that they're receiving the healthcare for, and creating a very compassionate and comfortable environment for these patients. And in the same way, working with different nationalities and backgrounds also gives you perspective. It gave me a perspective on issues, thoughts, values people have, which is awesome to gain that a more well-rounded perspective. And in that way also allowed me to build empathy and compassion, to connect past the differences and to find the common denominator there. Now, if you couldn't tell yet, I'm a kind of a numbers guy. And so seeing the number side of sort of healthcare and the healthcare system was also very big for me. A lot of times I would work through big data sheets and papers with a lot of numbers on there, being like ER statements, bills, grants, etc. And seeing that side of healthcare was very important and meaningful towards me too, because I really saw how interconnected and important, money is, and using that information to kind of draw conclusions to how can we allocate resources, how could we, leverage resources here, what do the patients really need? And so seeing that other side, that non-patient facing side, kind of gave me a fundamental scaffold, you could say, to really understand then where and what do I need to do on a larger scale to work towards and help the patients get the resources and adequate treatments that they need. And then lastly, active giving. Everyone feels, or I say most people feel great giving back to the community. I before this I did not live in Winston-Salem, and so kind of going with open arms. They received me with open arms in the community, and so it's sort of a way of giving back to this very, very nice hospitality that a lot of people in the community gave to me. And also seeing, the people in the community, the people around, the people you see at the grocery store, the people that you play sports with, etc. And in this way, working in the center of the community, seeing the people who need it most, understanding the struggles they go through, and in that way, sort of shape my perspective and really create meaningful impact as a student volunteer.
And so, while Chris might be a numbers guy, I'm more of a words person. So I talked to Tara O'Brien, who's the CEO of Cancer Services, to see how Public Health AmeriCorps has affected her organization. Tara highlighted how the length of involvement that members serve, which is a year, makes us members basically a staff member for the organization, and it adds capacity and support for the employees. We enable them to do a lot of projects that normally these organizations wouldn't be able to do without our support, and even develop our own projects and initiatives to really expand what the organization does. She also discussed how our unique perspective as students with our current majors and our variety of these young experiences as young adults navigating the world enables us to view things from a different perspective, and we can have a fresh outlook on problem solving. We can ask, why is this thing being done the way it is? Why is this process going this way? Is there a more efficient way to do this? Is there a better way to do this? We can come in here and shake things up, hopefully for the better. I try to always do it for the better, and really see what kind of problems we can solve. Finally, Tara also said how members enabled Cancer Services to expand their various services and improve the quality of their impact on the Winston-Salem community by enabling them to do more community outreach programs, quality assessments, and just generally more reporting and data to get a quantitative analysis on how the organization is being impacted and what impact they're having on the community. I also had quite a few meaningful experiences serving at Cancer Services. Similar to Chris, I really appreciated the opportunity to work with a diverse patient population. I got to engage with clients from various backgrounds and really learn to adapt my communication styles and even my language. As it was mentioned, I'm currently a Spanish major. I'm actually in Salamanca right now studying abroad. And so one of the skills I utilized most working at Cancer Services was as an interpreter or a translator for our Hispanic patients. And I was really able to build connections with them through our Hispanic survivorship group. And I was really excited to greet them whenever they came through the front door, ask how they were doing, and really just get to be that familiar face for them. I also learned how to support patients in their most vulnerable moments, which is very humbling and an experience that not many 19 and 20-year-olds in college get to have. I also focused on patient-centered program development. So a lot of our outreach it's for the patient. If it's not tailored to the patient, if they're not going to benefit from it, then we're just screaming into an empty void. So I learned how to consider patient perspectives when designing events and programs, and really focusing on accessibility, making sure that events were inclusive for all community members. Is this program going to be online or in person? If it's in person, where is it? Is it easy to get to? Do they need cars to get to it? If it's online, is the registration easy to navigate? Is the event itself easy to navigate? Is our website easy to navigate for some of that older population or even the younger population who might struggle with using a computer? I know I have my moments sometimes. Thirdly, I got to engage with healthcare professionals. I reached out to doctors from various specialties to invite them to collaborate with us on various educational and speaker events. And this led me to building a lot of connections with especially oncologists, which then led to shadowing opportunities, and really helped me hone in on my desire to be an oncologist surgeon, which now I'm more sure than ever is what I want to do in my future. I also got to strengthen my professional networking skills and deepen my understanding of various medical fields and how they all interconnect with cancer patients. And lastly, navigating the healthcare system. Anyone who's interacted with the healthcare system or the healthcare provider knows this can be kind of a beast to tackle. So I worked on a project connecting patients to cancer services through the various hospitals in Winston-Salem. And a big focus was figuring out hospital staff and departments that could advocate for us, because we wanted to get patients sent to us to help them, give them outside resources that the hospital might not be able to provide. Honestly, this was more difficult than it sounds. I had to work on a lot of advocacy strategies to support patients within these complex healthcare hospital systems. And I gained a lot of firsthand knowledge of behind the scenes hospital operations and the challenges that providers face in prioritizing patient care. So really looking forward to having all that in the future, but I'm very grateful for the experience that I've gained now and navigating all of that.
So why is student public health engagement important? So speaking to some peers of mine and kind of doing a Google search, I realized that there's really a lack thereof. There's a lack of students really going out into the community and engaging civically. I did a little search, as you can see, around 7% of 15 to 25-year-old Americans participate in 10 or more community engagements or political activities within the previous year, which is considered to be, really low activity. And as you can see, from Reagan and my experience, like there's really a lot of stuff you can learn as a student, and also, that the community service sites can benefit from. So if we look at student public health engagement, right? As Reagan and I were kind of telling you, it kind of promotes public health innovation, the resources that Reagan was creating at Cancer Services, the kind of data side of things that I was doing at the community care center, that technology part, it gives a gust of fresh or gust of wind, a breath of fresh air, to these sites that can sort of benefit from these unique, youthful, perspectives, and, from different majors and stuff. And in this way, you can really work on and tackle issues, or, lack of resources that are missing to sort of strengthen the community or strengthen that specific service site. And this way kind of work towards health equity, right? Do your small little part, but, adding small little parts will one day create a big effect. And what it also does is, early civic engagement really has long-lasting effects that people will come back, as they grow up. Through their life, they will continue to stay civically engaged, which is really important, when you go into life and society, and having a sort of a very, happy community, which is, I think, the fundamental thing, or the fundamental ingredient to having, a very successful county and city and stuff. So, and then lastly, I think the most important thing is, learning civic engagement early on really teaches crucial leadership skills and responsibility. A lot of times in school, they sort of talk about that safety net, right, before kind of graduating into the real world. Well, being able, or engaging civically during college really teaches you kind of in small steps how to one day become a public health leader, to see where the problems are in the community and sort of charge head on to work towards those issues.
And so lastly, we're going to get into how students like you or members like you can implement a similar program in your community. So to start off, it's worth mentioning that the whole Public Health AmeriCorps program at Wake wouldn't be possible without the Office of Civic and Community Engagement. This is an office at Wake Forest, a university, that provides opportunities for community engagement and service, as it says in the name. And they really support programs like Public Health AmeriCorps that Chris and I did, and they've been such a huge resource for us. And so I want to ask you, is there a program or office like this that exists in your community? If one doesn't exist, how can you find a similar support system, whether it's in your local government, with a current nonprofit organization, even within your friends and family? Can you create your own kind of scaffold system for this organization that you want to create? Because an office like this is one of the key ingredients in a public health student program. Now let's look at what are some others. So first off, you're going to need community partnerships. Collaborating with local organizations, health offices, and nonprofits that match the goals that you want to have with your program, and making sure that you're able to kind of really fight those social determinants of health and create systemic change within the community, not just putting a Band-Aid on the problem. Next up, student engagement, ensuring that students see the value in their hands-on experiences. As Chris and I have said, we gained a lot from this. You want to make sure that your students understand the value that they will gain from a program like this as well. Making sure that the program is sustainable, whether that's securing funding or institutional support from your school, from the government, from a grant, from a benefactor or a donor, making sure that the program is going to be able to be around for a long time to have a long-term impact. And finally, learning outcomes, providing a unique perspective on what people are going to learn from this program. With Public Health AmeriCorps, the key focus, as we've said and again, is social determinants of health. That healthcare doesn't start and end when you walk into and leave that doctor's office. It starts when you're sitting at home on the couch. It starts if you're more at risk for smoking or not. It starts in the community you live, if there's a park near you, if there's a food desert near you. This was the key unique perspective that we got from Public Health AmeriCorps. What would yours be in your program? And now, what are some of the steps to implementing a program like this in your community or university? We recommend that you start with your campus because this is how we found Public Health AmeriCorps, through WAKE and through the OCCE. You can partner with your school's volunteering or community relations office and build relationships with student organizations and faculty members that share your vision and want to support you. Oftentimes, they're connected to more resources that can help you. A key thing to mention is that your program aligns with your campus's values if it can. For example, as it was said when introducing Chris, Wake Forest's motto is Pro Humanitate, for humanity, and this perfectly aligns with the mission of Public Health AmeriCorps, making the program a perfect fit for Wake Forest. Next, you want to develop a structure, identifying your community's needs, whether that's if you're in a food desert, if you have a population that's at higher risk for cancer, if you have a higher prevalence of diabetes in your community, what are their needs? What do you want to target? What are the goals of your program? How are you going to target these? What do you want to accomplish in 6 months, in a year, in 5 years? Again, finding funding sources, because unfortunately, it's really hard to do things without money. Money always helps. Grants, university resources, sponsorships, the money's out there. You got to look for it. And also creating leadership roles and responsibilities for sustainability. For example, who's going to be the person that's checking in on your volunteers and making sure they're going to their service sites, making sure the service sites are receiving them, making sure the work's being done, the hours are being logged, that the impact is being monitored. You need people to do all that and to make it into a sustainable structure organization. And lastly, engaging the community, promoting inclusivity and accessibility for all students. If they need a car to get to their service site, is there a ride-sharing program? Is there a campus shuttle? Is there a bus they can take? Hosting workshops, service projects, and awareness campaigns to raise awareness in your community, kind of foment that consciousness of what you're doing, and making sure that the community is aware and excited about this project and organization that you're trying to implement. And finally, working with local health departments, nonprofits, and advocacy groups. These are organizations that already exist. They already have those ingredients that we mentioned, and they can be a huge point of interest and support for kind of creating your organization from the ground up. And so lastly, I just like to say public health programs are about giving back, building connection, and making a real impact. And by creating and participating in these initiatives, students gain leadership skills, practical experience, and a deeper understanding of public health. And so the final question that Chris and I are going to leave you with is, what will you do to support your community's health? And we'd like to give a shout out to the OCCE, and thank you to NC Campus Engagement and our community partners for supporting us. And our emails are there on the screen if you want to take a screenshot or anything. And now it's time for Q&A for both groups, I believe.
Exactly. Yes. Amazing. Thank you, Reagan. Thank you, Chris, for sharing more about how expansive this concept of public health is, and sharing not only that, but also your own experiences with Public Health AmeriCorps and your learnings with mobilizing students. So now we are opening up the floor for Q&A for either of the presentations. So if you have a question for any of our presenters today, please feel free to either unmute or put your questions in the chat. It is 4:56, so we might go a couple minutes over if there are loads of questions, which we certainly welcome. So please, if you have a question, feel free to either unmute or add it in the chat. All right, it looks like our first question is in. It sounds like this is for all the presenters. How do you balance all of this work with your class load?
I can start. I feel like that's a question that you get a lot when you're ambitious, and I can get the vibe that the four of us are very much that kind of person. I would say for me, and I feel like we can all probably relate to this, is when it's something you genuinely care about, it doesn't feel like you're trying to force it into your schedule along with everything else. If you genuinely find yourself loving wherever you are, whatever work you're doing, it doesn't feel like it's too much to add on top of your class load. But that might just be me. So anyone else want to chime in?
No, I definitely agree on that. It's if you really love your craft and really enjoy and see the impact that you're making, you will find time to make that happen. I do remember when being interviewed for the Public Health AmeriCorps program, they kind of highlighted how it's a big commitment, and it is a big commitment. Like I was kind of saying, 15 to 20 hours, during the semester is not nothing on top of classes, but I think really planning out your schedule, like I literally would have my schedule and I would block off times. And that way I can sort of make sure I can chase down the academics I need to do, but also go into the community care center and do the service that I want to do.
Yeah, I definitely agree with the blocking off time. I remember when I currently serve with Community Health Coalition, and that's around the Durham area in North Carolina. And I remember I literally had an 8-hour shift that night from 3 to 11:30, but I really, really wanted to volunteer at this event that morning from like, I think it was like 8 to 12. And so not bad, but that's a great example of like when you go through class, you have class. Some people like me, I had 8 a.m.s all during the week. I had class. I'm like a little tired, but I want to wake up and go because it's just something that you want to do and it's something that you love. And so I definitely agree with them. Like when it's your passion and when it's something that you're doing that fulfills you, I love feeling so energized and just so fulfilled by the people that I was serving. So I would say it definitely makes it easier when you're doing what you love.
And I feel like that ties in really well with the second question here, which is, how do you engage students who don't see themselves as community leaders? I think it starts with finding those passions, finding those values that they care about, and then seeing what aligns with those. So even if you aren't necessarily sure how your values or how your passion could translate into some kind of community work, or if you don't feel like you are the kind of person who can be a community leader, start by just figuring out, oh, I really enjoy working with kids. I really enjoy talking about food insecurity and or housing insecurity and working with people on that. That's something I care about. And then finding opportunities in those areas. Because the thing about social impact work and civic engagement work and community impact is that if there's an issue you care about, there's going to be a way for you to be able to get engaged in helping resolve it. And so, then from that experience, you are then a community leader. You don't have to go out and create something. You don't have to go lobby on the state to be civically or community engaged. And so I think, leading from those values, leading from passion is always a great step in building that confidence in what you want to do and building that leadership identity.
I would say if we're gonna, if we're gonna start answering the second question, which I absolutely love, I think for me as a community leader who wants to engage other students, I would say it definitely starts small. If an organization that you know of is having a special event, or if you want to organize your own special event on the weekend and invite some freshmen at your school who might want to dip their toes in public service or community service, but they're not sure how, a low commitment 3-hour event on the weekend, some music, cleaning up a river, doing some gardening, working with a local community, it's a great way to get people engaged without signing up for a full commitment, because that's really what can scare people off of the commitment of things. And once they get interested, if they like it, giving them opportunities of ways to continue to stay involved is kind of a good way to get that ball rolling and continue to foster engagement.
Yeah, 100%. Oh, sorry. You go ahead. You go ahead.
I was going to pass it off to you, so take it.
Kind of adding on to that, having little, immersion programs, kind of like a career day, like go into or shadow a community partner for a day and see if you like it. Go to, Habitat for Humanity for a day. Go to Second Harvest for a day, for example, to kind of see what they do. And I think this can also be something that could be integrated into like a curriculum, like sort of like a graduation requirement. I'm sure some universities have that, but kind of having a little bit of a, pushing people a little bit to do it, not too much, so that they can just, get a snippet, as my mom would say, no thank you portion. And sometimes you find out you really love, what you're doing, or you love the broccoli, that's on your plate. And in that way, just to, you kind of expose them to all these different kind of areas, so they can really find what they like, whatever public health issue they feel most passionate about tackling and working towards.
Yeah, I love that. I definitely agree. And I would consider myself as, I mean, I was a community leader, I would say, in high school, but in college, it's a huge place, and sometimes it's easy to feel a little lost. So I would say I kind of align more with like not necessarily feeling like a leader in college. And so I would say, especially into the third question, when I felt unprepared or I felt really scared to dive into something community based, I kind of just went with the fact of I'm going to be in a community. So I'm not going to be by myself. And so I think it's really important to also remember like social movements and civic engagement is like we're better together. And so a lot of times like it takes away a little bit of that stress when you say I'm doing this with other people that have the same love or that have the same passion as I am. So if I'm scared, I'm going to be there with someone who cares as much as I do. And so I feel like as much as we're serving our community, we also have communities in these environments, and I'm sure for you guys with Public Health and AmeriCorps, like you develop a family there. And so I think I would say to someone who is unprepared or is feeling scared, like just do it. And honestly, when you get there, you're going to meet an amazing person. That's exactly what happened to me. I met an amazing girl who was like, I just moved here from, Florida, and I'm in North Carolina now, and it's my first time. I'm trying to get involved, and like we made a connection that way. So I would say definitely go for it and like look forward to a community that you even can find in, these social environments as well.
Yeah, to kind of go off of what Jailah said, I loved your response. I think finding that community within is really important. If I was to advise someone else about having fears, being scared about going to volunteer, the fear might always be there. I myself am a very anxious person. I know I was really nervous going on my first day to cancer services, but there's got to be something in you that says, okay, I can set aside this fear and show up because I'm here to serve my community. It's honestly, you get to a moment where it's not about you, it's about your community. And so setting aside that fear of what if I'm not good enough? What if I don't bring the right skills? You're showing up. If you show up and 99 people don't, you're doing more than 99% of people. And that alone makes you qualified for the volunteering that you're going to do. And that's a great place to start. And it's a really good place to build your confidence and go from there.
All right, amazing. Does anyone have any final reflections on that last question there? What would you say to those who are interested in getting involved but may feel unprepared or scared? Reagan, I think that you gave Reagan and Aynsley gave a really thorough response to that.
As somebody who sort of made this idea of tapping into leadership potential sort of my passion project here in college, I think one of the things that we tend to sort of deviate to is extrinsic demonstrations of leadership, but leadership stems more than anything from the mindset that you bring to situations. And so those who want to try and get involved in leadership, those who feel like they're unprepared or scared, maybe it's because they're thinking about leadership in a more extrinsic way of, oh, because I haven't been the president of this thing, or because I haven't created this thing yet, I'm not fit to be a leader. But leadership is more than anything about tapping into your strengths. And so I would say, as we've all kind of been saying, start with, or encourage those who feel unprepared or feel scared to start with figuring out what their strengths actually are. So then they know what they can tap into, they know what they bring to the conversations, because that is such a confidence based knowing this is what I'm strong in, this is what I bring, this is why I'm valuable to be in this space. And then this is also how I can potentially utilize these skills that I have to advance the cause of the group that I'm trying to support. Clifton Strengths is an example of something you could potentially use just to kickstart that kind of conversation. Because I feel like when you're a leader, you think less about what are the tangible representations of leadership that I've been able to put out into the world, and more of how have I approached situations, how have I led teams, how have I worked with people, and how can I continue to sort of build that leadership identity. But yeah, so I would say having those conversations, trying to shift the mindset less from extrinsic indicators of leadership and more thinking about what are the internal things that I bring to the table that make me a valuable contribution to this conversation.
Kind of building off of that, I feel like as a leader, it's also your responsibility to pull people into your roles and kind of support them, kind of give them a hand to help them up. And so for people who are sort of thinking about or concerned or anxious about sort of taking that step, and being civically engaged, I think it's like many things just in life in general. Going to college the first day, you're nervous. The exam, you're nervous. The presentation, you're nervous. And so like Reagan said, I remember the first day being at the community care center. I had no clue what was going to be, what was in store for me, but kind of having that just going in blind and kind of just being there is really I would say the most important seed to sort of have a successful service, because going there with an open mind, really allows you to sort of go with the flow and see what is needed. I'm not just going to be here and sit around. I'm going to sit here and do what is needed. And then, after you've built that confidence, and I think as a leader, it's your role to kind of, pull the people down, pull the freshmen up, or help people trying to kind of move into civic engagement, kind of show them what it's like, to in that way kind of take the anxiety, take and help them make that jump, make that leap.
Thank you. I think that is an incredible last word. Thank you all so much for these amazing insights to conclude on. It was wonderful to hear you and excited to share this out with everyone else. So for those of you who are still viewing, thank you so much. If you want to continue to connect with Aynsley, Jailah, Christopher, or Reagan offline, or if you'd like to get in touch with them and ask them more questions, please definitely feel free to reach out to me. You'll have my email in the follow-up that I send you, along with the recording and more information about the other parts of the series, and I will be sure to connect you with them. So thank you all. This concludes the 2025 Civically Engaged Student webinar series. Thank you so much for joining today. And again, the recording of the session will be sent to you so you can rewatch it again and again and share it out with your networks as well. I also encourage you to go back and watch any of the previous sessions that you may have missed. So thank you again to our wonderful presenters today, and everyone, don't forget to stay engaged. Thank you.
Thank you so much.
Thanks, Sam, for sort of hosting and kind of being that person. I appreciate it.
Absolutely. Wonderful job.